If you've noticed your knees feeling stiffer when you wake up, or your hands taking longer to loosen up in the morning, you might be wondering if this is just normal aging or something more serious. What I'm about to share with you could be the difference between maintaining your independence for decades or facing severe mobility limitations in just a few years. As a rheumatologist who has treated thousands of patients over 60, I can tell you that there are 7 specific warning signs that predict whether your joint stiffness will progress into something far more debilitating, and most people ignore at least 3 of them. I'm Dr. Sophia Reynolds, and for over 20 years, I've specialized in helping older adults maintain their mobility and quality of life. I've seen firsthand how recognizing these warning signs early can completely change someone's trajectory from dependence to continued independence. Before we dive in, if you haven't subscribed yet, I highly recommend hitting that subscribe button and turning on notifications so you never miss another health tip made especially for you. If you find this video helpful, please leave your questions and suggestions in the comments. I read every single one, and it helps me create more content to help people just like you. Today, I want to share something that took me years of clinical practice to fully understand. Not all joint stiffness is created equal, and your body is actually giving you very specific signals about what's coming next. Let me walk you through each of these 7 predictive signs, and I'll share real stories from my practice so you can see exactly what I mean. The first sign that your joint stiffness might worsen significantly is what we call prolonged morning stiffness lasting more than 30 minutes. Now, you might think it's normal for your joints to feel a bit stiff when you first wake up, and you'd be right. But there's a crucial difference between typical age-related stiffness and the kind that predicts progressive problems. Let me tell you about Mr. Robert Chen, a 72-year-old retired accountant from Portland who came to see me 3 years ago. Robert had always been meticulous about his health, walking every morning and maintaining a healthy weight. But he started noticing that when he woke up, his hands felt so stiff that he couldn't grip his toothbrush properly for almost an hour. At first, he thought it was just the cold weather, or maybe he'd slept in an awkward position. He'd shake his hands, run them under warm water, and eventually the stiffness would ease up. What Robert didn't realize was that this prolonged stiffness, especially lasting more than 30 minutes, was his body's way of signaling significant inflammation in his joints. The key here is understanding what's happening inside your joints during sleep. When you're inactive for several hours, fluid can accumulate around inflamed joints, and inflammatory chemicals become more concentrated. If your joints are truly healthy, this process resolves quickly once you start moving, usually within 10 to 15 minutes. But when morning stiffness persists beyond 30 minutes, it indicates that there's active inflammation that won't simply go away on its own. This inflammation, left unaddressed, creates a destructive cycle where the joint lining becomes progressively more damaged. In Robert's case, we discovered early inflammatory arthritis, and because he sought help when he did, we were able to implement strategies that have kept him active and independent. But I've seen too many patients wait until the stiffness lasts several hours, by which point significant joint damage has already occurred. The second warning sign is stiffness that affects multiple joints symmetrically, meaning both sides of your body in the same joints. This is one of the most telling predictors of progressive joint problems, yet it's often dismissed as just getting older. I'll never forget Mrs. Patricia Anderson, a 68-year-old former teacher from Seattle who loved gardening and playing with her grandchildren. Patricia noticed that both of her wrists would become stiff and achy, especially after any activity. Then she noticed both of her knees felt the same way, then both ankles. She told me, "Dr. Reynolds, it's like my whole body decided to stiffen up at the same time." What struck her most was the symmetry. Both hands affected equally, both knees, both feet. She initially thought this was just arthritis running in her family, something she'd have to accept. But here's what most people don't understand about joint stiffness patterns. When wear and tear arthritis, what we call osteoarthritis, develops, it typically affects joints unevenly. You might have a worse right knee because that's the leg you favor, Or one hip might be more affected than the other because of an old injury. But when joint stiffness appears symmetrically, affecting matching joints on both sides of your body, it suggests a systemic process, something that's affecting your entire body, not just mechanical wear and tear. This pattern indicates that your immune system might be involved, releasing inflammatory chemicals that affect similar joints throughout your body. Patricia's symmetrical joint stiffness was an early sign of rheumatoid arthritis, a condition where the immune system mistakenly attacks joint linings. Because we caught it early based on this pattern, we were able to start appropriate interventions that have kept her condition well controlled. She still gardens, still plays with her grandchildren, and maintains her independence. But I've seen patients who ignored this symmetrical pattern for years, and by the time they sought help, they'd lost significant hand function and mobility. If you're still watching and finding this information valuable, please comment below to let me know you're following along. Your engagement helps me reach more people who need this information. The third predictive sign is joint stiffness accompanied by noticeable swelling or warmth. This combination is particularly concerning because it indicates active inflammation that's likely to progress. Mr. James Thompson, a 75-year-old retired firefighter from Denver, came to my office after his daughter insisted something wasn't right. James had always been the type to tough things out, never complaining about aches and pains. But his daughter noticed that his knees looked puffy, and when she touched them, they felt warm to the touch. James admitted that yes, his knees were stiff, especially in the mornings and after sitting for a while, but he figured that was just part of being his age. After all, he'd spent 30 years climbing ladders and carrying heavy equipment. What James didn't realize was that the combination of stiffness plus visible swelling plus warmth was telling us something very specific. Stiffness alone might be muscular or mechanical. But when you add swelling and warmth, you're looking at active inflammation inside the joint. The warmth he felt was increased blood flow to the area, bringing inflammatory cells and chemicals. The swelling was fluid accumulating in and around the joint space, a direct result of inflamed tissue. This isn't just uncomfortable, it's destructive. Here's the crucial part that many people miss. Every day that a joint remains inflamed, enzymes and inflammatory chemicals are slowly breaking down the cartilage that cushions your bones. Cartilage doesn't regenerate well, especially as we age. So each episode of inflammation causes cumulative damage. James's knees, which he thought were just stiff from old age, were actually being steadily damaged day by day. The good news is that once we identified the source of inflammation and addressed it, his swelling decreased, the warmth resolved, and most importantly, we stopped the progressive damage to his joint cartilage. He's now 80 years old and still takes daily walks with his dog, something that might not have been possible if we'd waited another year or two. The fourth warning sign is stiffness that improves with movement but returns quickly with rest. This creates what I call the activity paradox, and it's a strong predictor of inflammatory joint conditions that tend to worsen over time. Mrs. Elizabeth Martinez, a 66-year-old librarian from Austin, described this pattern perfectly. She told me, "Dr. Reynolds, it's the strangest thing. When I first stand up from my desk, I can barely walk. My knees and hips feel locked up. But if I walk around for 5 or 10 minutes, I actually feel better. Then if I sit back down for even 20 minutes, the stiffness comes right back, sometimes worse than before." Elizabeth had discovered something that many of my patients notice but don't realize is significant. This pattern, where movement temporarily relieves stiffness but rest brings it back quickly, is characteristic of inflammatory arthritis rather than simple mechanical wear and tear. With mechanical joint problems, movement typically makes things worse because you're putting stress on damaged structures. But with inflammatory conditions, gentle movement actually helps pump inflammatory fluid out of the joint space and increase circulation, providing temporary relief. However, and this is the critical part, because the underlying inflammation isn't being addressed, the stiffness returns as soon as you stop moving. Your body is essentially telling you that there's an active inflammatory process that movement can temporarily override but not resolve. Elizabeth described her daily life as a constant cycle of moving to feel better, resting because she was tired, then feeling worse again. She was adapting to this pattern, not realizing it was a clear signal that her joint problems would progressively worsen without intervention. When we addressed the underlying inflammation in Elizabeth's case, she noticed something remarkable. She could sit through an entire movie with her grandchildren without her joints locking up. She could work at her desk for hours without needing to get up and walk around every 20 minutes just to function. That activity paradox resolved because we'd addressed the root cause, the inflammation, rather than just managing symptoms. But if this information is surprising to you, wait until you hear about the fifth sign, because this one catches almost everyone off guard. The fifth predictive sign is stiffness, that's worse in certain weather conditions, particularly cold, damp weather, or when barometric pressure drops. While many people joke about being able to predict rain with their joints, this sensitivity is actually a serious indicator of progressive joint problems. I remember Mr. William Foster, a 71-year-old retired pilot from Boston, who kept a detailed journal of his joint stiffness for 3 months before coming to see me. William was analytical by nature, and he'd noticed a clear pattern. On days when it was cold and rainy, his hands and knees were significantly stiffer, sometimes to the point where he had difficulty buttoning his shirt or walking downstairs safely. On warm, dry days, he felt much better, almost normal. He showed me his journal with temperature, barometric pressure, and his pain and stiffness ratings, and the correlation was undeniable. Here's what's happening inside your joints when weather changes. When barometric pressure drops, which typically happens before storms, the pressure inside your joints remains relatively higher. This pressure difference causes inflamed and sensitive joint tissues to expand slightly, putting pressure on surrounding nerves and increasing stiffness. In healthy joints, this effect is minimal and barely noticeable, but in joints with active inflammation or damage, the effect is pronounced and painful. The reason this predicts worsening problems is straightforward. Joints that are significantly weather-sensitive have enough inflammation and structural change that even minor pressure variations cause major symptoms. This indicates that the joints are in a vulnerable state where small stresses create large effects. Without intervention, these joints continue to deteriorate because the inflammatory process continues. William's weather sensitivity was an early warning that his joint problems would progress, and indeed, when we looked more closely, we found early signs of inflammatory arthritis that needed treatment. Since starting appropriate management, his weather sensitivity has decreased dramatically. He still notices some change with major weather shifts, but it no longer significantly impacts his daily function. The sixth warning sign is joint stiffness accompanied by unusual fatigue, especially fatigue that seems disproportionate to your activity level. This combination is one of the most overlooked predictors of progressive joint problems because people tend to think of joints and energy levels as separate issues. Mrs. Dorothy Williams, a 69-year-old retired nurse from Chicago, came to me primarily complaining of exhaustion. She told me, "Dr. Reynolds, I used to work 12-hour shifts on my feet, caring for patients, and I'd come home tired but satisfied. Now I do a load of laundry and need to nap for 2 hours. I don't understand what's wrong with me." As we talked more, she mentioned that yes, her joints were stiff, especially her hands and knees, but she'd barely focused on that because the overwhelming fatigue was what truly bothered her. What Dorothy didn't realize was that these symptoms were intimately connected. When your body is fighting chronic inflammation in your joints, it's also producing inflammatory chemicals called cytokines that circulate throughout your bloodstream. These cytokines don't just cause joint stiffness. They also trigger fatigue, sometimes profound fatigue. Your body is essentially in a constant state of low-level immune activation, as if you're always fighting off an infection. This is exhausting for your system. The reason this combination predicts worsening joint problems is that it indicates widespread systemic inflammation rather than just localized joint wear and tear. When inflammation is systemic, it tends to progress and affect more joints over time. Dorothy's fatigue was actually her body telling us that her immune system was overactive, not just in her joints, but throughout her entire system. Once we identified and treated the underlying inflammatory condition, something remarkable happened. Not only did her joint stiffness improve, but her energy returned. She told me, "I feel like myself again." I didn't realize how much that constant exhaustion had been limiting my life. The seventh and final warning sign is one that many people miss entirely: stiffness that's accompanied by gradual loss of range of motion, where you notice you can't move a joint as far as you used to. This isn't just about pain limiting your movement, it's about the joint physically not moving through its full range. Mr. Anthony Rodriguez, a 73-year-old retired carpenter from Miami, noticed over about 6 months that he couldn't reach as high with his right arm. At first, he thought it was just stiffness, but then he realized that even when he tried to push through the discomfort, his shoulder simply wouldn't move as far as it used to. He couldn't reach items on high shelves anymore, and putting on a jacket became awkward. He mentioned this almost as an afterthought when he came to see me about knee stiffness, not realizing it was actually one of the most concerning signs. Here's why this matters so much. When a joint is chronically inflamed, the body tries to protect it by laying down scar tissue and causing the joint capsule to contract. At the same time, inflamed tissues can develop adhesions, where surfaces that should glide smoothly against each other begin to stick together. In the early stages, this loss of range of motion is reversible with proper treatment and therapy, but if left unaddressed, it becomes permanent. The joint literally becomes structurally limited, and no amount of treatment can fully restore the lost motion. Anthony's shoulder was heading down this path. He had inflammatory arthritis affecting multiple joints, and his shoulder was developing what we call frozen shoulder, where chronic inflammation was causing progressive loss of motion. The stiffness he felt was both from the inflammation and from these structural changes beginning to occur. Because we caught it when we did, we were able to implement aggressive treatment and physical therapy that preserved most of his shoulder function. But I've seen patients wait too long, and by then, the joint is permanently limited, severely impacting their ability to dress themselves, cook, or perform other daily activities independently. If you've recognized yourself in any of these 7 signs, I want you to understand something important. This isn't about scaring you, it's about empowering you with knowledge. Each of these warning signs is your body's way of communicating that something needs attention. The earlier you recognize these patterns and seek appropriate medical evaluation, the better your chances of maintaining your mobility and independence. Let me be clear about what to do if you're experiencing one or more of these warning signs. First, don't dismiss your symptoms as just normal aging. While some stiffness is common as we get older, the specific patterns I've described today indicate processes that will likely worsen without intervention. Second, document your symptoms. Note which joints are affected, whether it's symmetrical, how long morning stiffness lasts, what makes it better or worse, and whether you're experiencing other symptoms like fatigue or swelling. This information is invaluable for your doctor. Third, schedule a comprehensive evaluation with your healthcare provider. Depending on your specific symptoms, this might include blood tests to check for inflammatory markers, imaging studies to assess your joints, or referral to a rheumatologist who specializes in joint conditions. The goal isn't just to diagnose what's happening, but to create a personalized treatment plan that addresses the underlying cause of your stiffness. Fourth, understand that treatment is most effective when started early. Whether your joint stiffness is from inflammatory arthritis, osteoarthritis, or another condition, intervening before significant joint damage occurs gives you the best chance of maintaining function and quality of life. Treatment might include medications, physical therapy, lifestyle modifications, or a combination of approaches tailored to your specific situation. Fifth, don't underestimate the power of appropriate exercise and movement. While it might seem counterintuitive when your joints are stiff, the right kind of exercise can actually reduce inflammation, maintain range of motion, and strengthen the muscles that support your joints. The key is working with professionals who can guide you toward exercises that help rather than harm. Remember the patients I told you about today: Robert, Patricia, James, Elizabeth, William, Dorothy, and Anthony each recognized warning signs and took action. They're all maintaining active, independent lives because they didn't ignore what their bodies were telling them. The same opportunity exists for you. Your joints have a remarkable capacity to function well into your later years, but they need proper care and attention, especially when they're giving you these warning signs. Don't wait until stiffness becomes disability. Don't accept limitation as inevitable. With the right knowledge and appropriate care, you can maintain your mobility, your independence, and your quality of life for years to come. If you found this video helpful, please share it with someone who might benefit from this information. Leave a comment telling me which of these 7 signs surprised you most, or share your own experience with joint stiffness. Your stories help create a community of support and shared learning. And remember, subscribe and turn on notifications so you don't miss future videos where I'll continue sharing insights from my years of clinical practice to help you stay healthy and active. Most importantly, if you're experiencing any of these warning signs, make an appointment with your healthcare provider. This information is meant to educate and empower you, but it's not a substitute for personalized medical advice. Your doctor knows your complete medical history and can provide the specific guidance you need. Stay active, stay informed, and take care of those joints. They're meant to carry you through many more years of the life you want to live.